I see something. We're live.
We're live on YouTube. I sure hope so. Hello. You're live. Okay. Fantastic. Okay. Let me see who is here with us today on this beautiful Tuesday evening.
I hope we didn't lose people. Come back on. Okay, we'll give it a few minutes here to make sure that we have everybody joining this evening who will be joining. Make sure we have all of our comments set up. I can make a. Wait, did you give me an. Okay. I can do it on my stories and say, okay, come join now.
Yes, great. Okay, fantastic.
Oh, it's just a photo. Okay, wait. You're just a blank screen.
No real life Lexi. Okay. We're on YouTube. We're live. Okay. We'll just give one more minute here, Jill.
Yeah, no rush.
For anyone who's here already, you can drop your questions in the comments and we will be sure to get to them through this Q&A session with Jill. I'll be taking note and kind of moderating the chat, so post any questions, thoughts you have there that you'd like to address today.
All right, I did a post.
Great.
Just in case people left and thought it wasn't happening. I can't even go in the.
Hi, Jill, you rock. Nice. That's the first
I
time.
know, and I can't even respond. Oh well. I can't see you. I can't respond.
Let's see. Okay, well, we are gonna roll with the punches today.
Let's do it.
As we do every day. Well, first off, Jill, I want to welcome you to the community and thank you for coming to do this Q&A session today. A little about Jill. She is a pelvic health physiotherapist and founder of Endo Together, a resource platform for people with endometriosis. Drawing from her own lived experience navigating endometriosis, multiple surgeries, fertility challenges, and years of period pain, Jill transformed her approach to pain management using evidence-based pain science strategies. She no longer experiences period pain and has built a clinical practice helping others reclaim their quality of life. Jill specializes in integrating pain neuroscience education, pelvic floor rehabilitation, and holistic wellness strategies. She's passionate about demystifying endometriosis and empowering patients to become active participants in their own recovery. Amazing. I'm so thrilled to have you here today, Jill.
Well, thanks for having me.
And a little about me, my name is Lexi Burt. I am a admin at Endometriosis Canada. I'm also working on my master's degree studying endometriosis research and also work as a fertility consultant. So I'm so thrilled to have everybody here today to watch this Q&A. As I said, if you're just joining, please throw any questions, comments, thoughts, concerns you have in the chat, and we will be jumping to them.
Awesome.
I guess to start us off, Jill,
Hmm.
I'm curious to hear from you a little bit. We know that the average diagnostic delay is about 9 years for endometriosis. What role could physios play in kind of supporting people earlier, either just for, pain reduction or to getting that diagnosis quicker, especially if people have never even thought of a physio for endometriosis? Let's kind of use that as a jumping off point.
Yeah, well, pelvic physio is pretty exciting because it was and probably still is one of the fastest growing healthcare arenas out there right now in the healthcare field. So I think it's first and foremost really important for us as pelvic physios to understand the signs, symptoms, because it's not always just period pain. And that's where things can get confusing for people. I've had patients who had a nosebleed every month. I had a patient whose belly button would bleed every month. If there's cyclical leg pain, it might not be period pain. It might be fertility issues. And if the doctors are not educated in this arena and saying these words of endometriosis, we might be the first people to say that word. That word, though, comes with a caveat in the sense of you need to be able to know how to direct somebody past that, because what we don't want is for people to depend on going on Dr. Google and support groups, which are often not supportive. They can make you feel like scared and fearful and confused. So it needs to come with some extra steps. I think it's important for us to get to know who to refer them to. A big portion of what I do with my patients, who are mostly people with endometriosis now, I'm seeing people who know they have endometriosis, have heard this word, but a lot of us in this profession might be first meeting people with all of the symptoms of cyclical pain, period pain, pain with intercourse, pain with defecation, especially around your period. That is like almost a telltale sign, highly correlated with endometriosis. So if we know these things, then we can gather up our resources in our area of who understands endometriosis from a gynecological standpoint. Maybe if there's imaging is growing in terms of who to send them to the right people who know how to read the imaging. You can't just go to I'm covering so many topics right now, but as pelvic physios, we can be so instrumental in guiding people, and it might be the start of their journey. If it's midway through their journey and they are suspecting that they have endo and they are kind of have that set up in the medical system, that's when we can look at them as a whole person and dive into what is contributing to their pain.
Yeah, lots to kind of cover there. So really, like, the symptom recognition is such a big piece, and then obviously having your support to guide them in the right direction. I've seen a couple pelvic floor physios throughout my own endometriosis journey, and I had seen physios prior to, addressing period pain and the symptoms I was having, but I never put the two together, that there's like a pelvic floor physio. So for people who this might be new knowledge for, tell us a little bit about what you do and what would happen when they go see a pelvic floor physio.
Okay, so not all pelvic physios have the same training. So I think that it's like going to any doctor. You want to kind of maybe seek out that niche pelvic physio that understands endometriosis, for example, because that's not in our core learning. But if you're with someone who is psychologically informed and trauma informed, that is like so important, because oftentimes we've been through being poked and prodded, and we don't like the idea of getting more poked and prodded. So pelvic physios are trained to be able to do an internal manual vaginal or rectal exam with the purpose of checking the tone of the pelvic floor, which has less to do than sensitivity. Sensitivity is more important. So we hear these word trigger points and stuff. That's actually been dispelled in research. What's more important is if there's tenderness to normal touch of the musculature of the pelvic floor, where it is almost more sensitive, which is really common in the caseload that I see. The driver to that may not be just the pelvic floor. The pelvic floor muscles are like soldiers. They do what they're told. And I always want to know, who's your boss? Who's telling you to be on guard? And oftentimes that's an upregulated nervous system. So you want someone who takes what we call a biopsychosocial approach, who's going to look at you, who is sitting in front of them, who has had many experiences with their endometriosis, in seeing a lot of people who have dismissed them probably over the years, who haven't mentioned the word endometriosis, who are getting passed off to a gynecologist, to a urologist, to all of these different disciplines, and no one's putting the pieces together. Our job is very much helping connect the dots and looking at you as a person experiencing pain, exhaustion, uh, pain with intercourse, challenges cyclically, like all of the maybe painful urination, painful defecation. And we are looking at you as a whole person rather than segregating, oh, I can't talk about the rectum because that's in one person's discipline, and I can't talk about the bladder because that's in another person's discipline. So we're looking at a bit more of the whole picture. But you want to find somebody who kind of takes that, what we call biopsychosocial approach, because we are humans with a body attached, and you're not just your endometriosis.
Thank you for that. Amen. And yeah, there's a couple things I wanted to ask there. You mentioned just about, trauma informed and that safety approach. So how does this play into the physical body?
Huge. So maybe people have heard the word somatic therapy. I find that more and more people are kind of hearing that word. Somatic means body. So maybe they've heard the book, The Body Keeps the Score. There's some controversy on the wording of that now. But basically, we can, our cognitive, this is not correct, but it's almost like we have two brains, a primal brain that really just looks at our safety. Are we safe or not safe? And then our cognitive brain, which is ambitious and motivated and can ignore symptoms and get shit done. Am I allowed to swear?
Oops. Yeah.
Okay.
We're live.
It comes out sometimes. Where we're working and we're functioning in life, like not thriving, but getting through life, maybe not. But you want someone who, like that, those experiences that we've been through, if our primal nervous system thinks that we're in danger, it will present some way. It'll present as irritability or moodiness. And maybe when you've been around people for a long, during your day, you just are like, I need to be alone. Or it might come with tension in the body because it's ready to fight or flee, right? Or it might come with like, oh my gosh, I'm completely overwhelmed. I'm brain fog. Don't overwhelm. Don't tell me anything more. I can't focus, and exhaustion. And that's maybe more on the side of freeze. So you need I think we need to notice what sort of state your nervous system is stuck in survival wise, and what can we do to facilitate it feeling more safe? And that may not be, as a pelvic physio, poking and prodding your pelvic floor. So I'm matching where their nervous system is, which might be a few steps behind their motivation, their ambition. And I'm like, let's just see where your nervous system is, your primal nervous system, which was a big part of me kind of pulling back and noticing, oh, I'm in survival mode, and recognizing I needed to hone it back a bit and then build that back up to being able to tolerate what I wanted to do in life. Does that make sense?
Yeah, absolutely. And I think when we're dealing with a lot of pain and a lot of symptoms, you're just focusing on like, well, what do I have to do to get to the next moment? You aren't even taking that time to step back a little bit and be like, where is my nervous system? Or maybe you don't even have the knowledge of the nervous system and how it's
Yeah.
functioning, either working with or against you.
Yeah, it's a huge part of what a big part that I'm screening for through questionnaires, through the interview with the patient, and then through assessing how their body responds with the therapy in person, or a lot of times we can do this virtually, and I'm getting them familiar with their nervous system and they're giving me feedback, and I can see, yeah, it's kind of cool. You can do it virtually too.
Well, just kind of on this note of like getting into pelvic floor physio and again, finding the right one, maybe someone who's actually specialized in endometriosis and acknowledging trauma and safety in the body and the nervous system. Let's talk about options that people have because I think we've all felt maybe disempowered in the medical system, and
Yeah.
that we didn't have a choice. So somebody comes in and they start working with you, and what options do they have? You mentioned physios can do physical exams. What if somebody's
Mhm.
not comfortable? Like, what agency do we have in beginning?
Everything. It is, you have all agency. I make that really clear with my patients because I have quite a few patients who think that, actually, I have quite a few patients who come in because the doctor told them to come in and they have no idea what pelvic physio is. I have other patients who are like, I guess I'm going to have to get a pelvic exam. And they're like, they're like this the whole time. And I'm like, let's just notice how your body's responding. Because it might not be consenting. Like, this is where this brain is like, okay, just go, make me better, fix me. And I'm like, and your nervous system is like, oh God, it's like guarded, right? So we want to, I might be saying, let's listen to your nervous system. Let's get it. So I have a lot more tools than my standard training of pelvic physio in terms of trauma. So I feel comfortable not doing an internal. It's just another data point that I'm gathering. I can almost guess when their pelvic floor is going to be sensitive to touch and that sort of thing through the interview and all that. And so we might find out where that needs to start. Maybe that's not hands-on. Maybe that's doing somatic therapy. Maybe that's doing like exercises or movement, or looking at what they're doing in their cycle and shifting what they're doing in their cycle to create more safety messages. It really depends. I'll assess the patient, say, here's what I think is or looks like is contributing to your symptoms, and it might be a few, but I look at those as opportunities to make change. And
Hmm.
so I'm like, where do you feel in your gut is a good place to start? Do
Hmm.
you want to start with movement? Do you want to look at your cycle and like set up a plan for you this month? Do you want me to put my hands on you, like get your digestive system moving a bit better? Do you want me to check your pelvic floor? Would that make you feel better? So it's really giving them that sense of control back, as you mentioned, which we feel like we don't have in the medical system.
Yeah, thanks for saying that because again, maybe if somebody's told by their doctor they should come in, they're just like, okay, I'm just here because I'm supposed to be here, do the thing. But that's really
Yeah,
not what this approach is.
it shouldn't be. It shouldn't be.
So we have a question in the chat here. So any exercises that can help with bloating and bladder pain?
Okay, so Bladder pain is, as long as a UTI has been ruled out, bladder endometriosis itself is actually pretty rare. Caveat, I don't know how much in those research studies, like they say 1 to 2%, and let's say 70% of people with endometriosis have, I think it's like 50 to 70% of people have urinary symptoms, either urgency, frequency, or painful bladder, whether that means pain on getting a lot of urine in that stretch or pain on peeing. Usually it's with the stretch, like letting it go too much. That's usually driven by a sensitive nervous system. So that's called bladder pain syndrome. It's usually less about it being endometriosis, but we don't know this, right? So if we have endo and we have bladder pain, we assume it means endo is on the bladder.
Mm-hmm.
And it's pretty rare. It could be, but most times it's not. And so when it comes to bladder pain, there is a desensitization strategy. That's not an urge delay technique. So if this person who is asking has been to a pelvic physio where they're saying, just slowly hold your bladder longer and longer, that's actually not what you should do when you have a sensitive, painful bladder. There is a specific desensitization strategy. I will put this out there. There is a friend of mine in the UK. Her name is Jilly Bond, and she has a happy bladder course for patients that talks about this. Great resource, really reasonable price. One of the best research. She just got her PhD. She just did her PhD research in pelvic pain, and it's a great course. So if somebody wants that specifically, or they can send me messages and I can give them somebody around. Now, when it comes to bloating, bloating's interesting, and I work with a dietitian on in a group program that we have, Endometriosis 360, and I've learned so much from her, Emily Arthur. She's the period, oh my gosh, what's her? The period RD. I'm missing something. The period RD? I think that's her. Emily, the period RD is her handle on Instagram. So she, with bloating, she has said, like, I notice in the program, most people get bloating associated with, we always think of the physical, what am I eating? But oftentimes it's like people are not eating enough. So they have slow digestion, they have constipation. That constipation can create fermentation and gassiness. So one of the things she suggests, and I'm sure she's okay, she talks about it all the time, I'm sure she's okay with me saying this, to eat timed eating. Because when your nervous system's not in rest and digest, first of all, your digestion is going to be off. Secondly, you're not going to have hunger cues. Do not go by hunger cues. You need to eat something, not big meals necessarily, every 2 to 4 hours, because our digestive system is a muscular system like any other system. And if we're not making it work, it's not going to move the stool along. Things are going to sit there. It's going to get like really bloated. Now, so that's number one. Make sure you're eating regularly. From a physio standpoint, from a movement standpoint, there's lots we can do. I like yoga because a lot of yoga is like rotational and bendy in the middle, which helps to ring the digestive system and move stool along. So even if you put on YouTube, like I like yoga with Adrienne, Adrien.
Yeah.
And if you put in digestion into she has hundreds of videos. So just put in digestion and it'll be really honed in on all of those rotational sort of digestive, soothing movement from an exercise standpoint. There's the ILU massage you could look up on YouTube too. For me, I have a million things. You could put your feet on a stool to help you have a bowel movement. Now, if you have painful bowel movements, you can actually go pee And then put toilet paper around your hand and support your perineum, which is the space between your anus and your vagina. Support that as you have a bowel movement, and it'll help you feel less like vulnerable when you're having a bowel movement. It might help your pain a little bit. But this is where pelvic physio is really helpful to help you with that's one thing maybe people don't know, is that I treat a lot of people with digestive issues. It's one of my favorite things to treat. But pelvic physios generally are pretty good about treating digestion.
So many wonderful resources there. I put Jilly's Happy Bladder course in the chat there for anybody watching. I also linked Emily, the Period RD's Instagram handle, so you guys can go take a look at that too. Jill, I'm wondering too, are there any at-home exercises that can help relax pelvic muscles that are too tight? And is this something that you maybe would work with a patient and then they would take these things home, or are they only doing these things when they're seeing you?
Oh no, what they do outside of me is like everything, right? So it doesn't mean they have to do it all the time, but it depends on the driver to the tone. And also if they're are they aware that they're tight? So I might get them to become more aware of like, okay, can you contract? And this is where an internal is helpful, because it's more feedback. It's feedback for them. If they contract, like do a contraction of their pelvic floor, when they let go, can they sense that they're letting go? Or are they only letting go halfway? And I'm like, okay, you're halfway there. See if you can let that go a little bit more, because the brain can't tell where neutral is, right? Like it can't tell if it's relaxed sometimes. If it's been like this the whole time, it's hard to let go. I have so many ways of assessing what the reason is for that, so I won't get into that. But if we can find what works for them, which is different for everybody, then I will give that to them as homework. And that might include some stretches. That might include the more varied positions, like if they're on all fours and relax, is it easier for them there? Can they do it sitting? Can they do it standing? Not just lying down, because we want your brain to be able to process how to relax the pelvic floor in all sorts of positions. Right? And we don't want people to fear contracting their pelvic floor. Research shows that that can be a part of your therapy, even with pain. I think it helps connect the brain to that area. Our brain, we can see most of all of our other muscles, right? But we can't see our pelvic floor. So getting people familiar with their pelvic floor and understanding this is a contraction, this is a relaxation. Okay, can I do that when I'm sitting? Can I do that when I'm standing? Can I do that when I'm doing happy baby? Or these different, I want them to be able to connect to that area so they feel more in control of that area. Does that make sense?
Totally. There's another question from the community, but we're talking about the pelvic floor, pelvic floor. A lot of people don't know even what the pelvic floor is. So if you could give us just a quick synopsis
I
description.
have a model. Do you want me to
Oh,
get the model?
fantastic.
Okay, I should have thought of that earlier. It's like show and tell.
Yay.
I love show and tell. Okay. So actually, let's get the participants to participate. Okay. So here's the pelvis as if I'm looking at you. Here's the pubic bone. So what I want you to do is find your belly button and then work your way down in the soft lower part of the belly to find the harder part, which is your pubic bone. And it's pretty low, right? Okay. Now put your hands on your hips as if you're like standing like proud of yourself. That's on these iliac crusts. Find your little pointy bone in the front. And then you can come under your bum on either side and wiggle back and forth and find those little bones on either side here. And then if you sat on your hand, like if you want to sit with your hand like it's a pad, That is your pelvic floor. And we have three different layers. So the outer layer is more our sexual muscles around our clitoris and nuts and our urethra. But the deeper muscles are more of our inner core. So when we talk about, the bottom of the core, and then the diaphragm is the top of the core, and they're attached through the deepest of the abdominal muscles. There's 4 layers of abdominal muscles. The deepest one's called the transverse abdominis, and then they're attached to fascia and little muscles along the spine called the multifidus. So it acts like a canister, and that canister is our sort of our support system before we lift heavy things. It's our stabilizers. And the diaphragm and the pelvic floor very much work together by, like, they both, when we breathe in, it doesn't feel like this, but when we breathe in, our diaphragm actually goes down. So think of a balloon. If we squeeze the middle of the balloon, like if you're a gut gripper, then the pressure is going to go down into the belly and you're not going to be able to breathe very well. So we need to be able to let that belly go, which isn't easy to do when we feel uncomfortable, when we feel swollen, when we feel like we look like we're 6 months pregnant. It's like, let's suck it all in. And then you might have this sense of heaviness or fatigue in the pelvis, pressure, that sort of thing. So that whole system needs to work together. You need to be able to allow yourself to breathe. That's a big thing. Sometimes for some people, it might be focusing on the breath, and that I can tell that's how their pelvic floor releases. So it's not like the pelvic floor gets all of the attention. I'm finding out who's the biggest driver to be able to relax this. For some people, it's not even focusing on the body, it's focusing externally, and the body responds by it calming down, right? Sometimes coming into the body is like too much. But the pelvic floor is that those muscles between the sit bones, between the pubic bone and the tailbone. And it's a bunch of little muscles together down in there.
I thought it was so fascinating when I started doing physio that my endometriosis physiotherapist shared that, where do you hold your tension in your body? A lot of people, their shoulders are up to their ears and they're in their traps, but you can hold that stress in your pelvic floor too. So that was such a interesting activity for me.
And often it's not just the pelvic floor. There'll be the pelvic floor, the abdominal muscles,
Right.
the breath, the
Right.
shoulders, and the jaw. The jaw even has a lot of connections fascially all the way down. So we're kind of looking at this whole chain. And you're not a hot mess. They go together. They're soldiers together.
We
And
got
they're
a
just protecting you. They're protecting you. Don't be mad. Oh my God, there's so much research on when we hate our body. Increased inflammation, increased immune markers. So I really spend a lot of time reframing people's understanding of what their body's doing. It's doing what it thinks it needs to do. We need to make it feel more safe, and then it won't be on its guard as much. And that's so important.
We could have a whole separate Q&A on that topic specifically.
I
We
know.
have a comment here from Emily. Hello, stage 4 endo and adenomyosis. My surgeon also diagnosed hypertonic pelvic floor. My surgeon won't do surgery until I do pelvic floor physiotherapy treatment. I'm curious your opinion on this.
So here's why, and there's some research, not specifically on the pelvic floor, but the pelvic floor, if it's driven by a sensitized nervous system, we can actually screen who's at risk of coming out of surgery more pain. So when it comes to the pelvic floor, for example, this is why it's important to get somebody who can look at the whole picture. But if you're going into surgery and you're in this guarded position, they don't cut out the guarding. You're going to come out. They want you to be able to be able to release that, relax that, feeling more in control of that before surgery, so that you're not doing it in the rehab stages of getting better post-surgically. So it sounds dismissive. It sounds frustrating because in our minds as patients, we're like, if you just get rid of the endo, I won't be in as much pain, because I know Emily is thinking this, and give me a heart if that's what you're thinking. It's like, just get rid of the endo, I won't be in as much pain, and then my pelvic floor will feel better, which I get, and sometimes that is the case. But the evidence is also pretty strong in setting up our recovery, optimizing our recovery afterwards. We can do that. And this is where we're blessed in Canada that we have such a waiting time, so that we can work on that. I call it a blessing.
I like
Yeah.
that reframe. I like that,
I
Jill. Thank
know.
you for that.
Yeah.
Another question we have in the comments: can pelvic floor physio help teens with pelvic pain and suspected endo?
100%. God, if we could get teens, what a blessing. What a blessing if we could get them so early. There's research. Okay, I sound like such a, I mean, I love research, but let me just give you this stat. If you're 15 and you have pelvic pain, period pain, you're more at risk of having multiple chronic pain illnesses at 26.
My
So if we can address it at 15, your risk of it not going into POTS and MCAS and histamine issues and eczema and all of these other things that are linked to our immune system being off and all of those other things, it can, oh my gosh, absolutely. And it doesn't mean you need an internal.
That's important. Yes.
It is important. Yeah.
Next question. Can a tugging feeling in my diaphragm when I'm coughing being caused by tension or adhesions down in my pelvis?
Sure. It can. It, like I said, the diaphragm and the pelvis are attached anyway. It could be because of adhesions. It might not be. Might be tension. This is where maybe finding somebody who does visceral fascial therapy. So maybe an osteopath who does visceral fascial therapy, or a physio or pelvic physio who does it, like I do it, can see if there's a lack of mobility somewhere, and we can just get it moving a bit better so it's not tugging as much. Yeah.
That's all the questions we have in the comments. But Jill, I wanted to thank you so much for your time today, and everybody who's watching and giving their questions. If people have more questions for you, Jill, or they'd like to work with you, what's the best way they can reach you?
I'm on Instagram at Endo Together, as you mentioned. I work at a clinic called Healthy Balance Physiotherapy and Wellness in Oakville, Burlington. I have a team I've trained, so takes a while to get in with me, but the team is amazing. We have an endometriosis program there. And if you want to email me, you can email me at Jill at HBPW, so Healthy Balance Physiotherapy and Wellness.ca.
Fantastic. We will make sure to link this actually, and we can put it in the community for people, for anyone who didn't catch that. But again, I wanted to thank you so much for bringing your knowledge and your time. I think it would be greatly appreciated all around.
Well, thanks for having me.
Okay, everyone, have a good night, and we'll talk soon. Bye.
Bye.